Hi friends, I am Dr. Rohit Udaya Prasad. I am a lead consultant at Aster RV Hospital, JP Nagar, Bangalore. I am here to discuss about a few problems that parents come to us with for their children. Very common thing that a lot of parents see nowadays is something called as snoring. So, most of the families they find that either everyone is snoring in their home, the child is snoring a lot, the child is mouth breathing, snoring, the parents are really worried, why is the child snoring so much. Some of them do not even know that that is abnormal, that the child who is snoring with the mouth wide open, they do not realize that the child is having a problem. A lot of them push that for a long duration because they think that it is a normal thing to see in everyday's everyone's life, but it is not something that you can afford to neglect. Snoring in children, especially in the age group less than 5 years, is a common problem that is seen especially in the cities nowadays. A lot of these children have something called as an adenoid hypertrophy. Most of the times these children suffer with repeated upper respiratory tract infections. They have frequent episodes of running nose, cold. They do keep visiting their pediatricians for a regular treatment, which symptomatically gets their problem solved, but the long standing symptom of breathing from the mouth or snoring along with it keeps on persisting. We definitely see this trend on the rise of late. Lot of reasons are there for this to happen. Many a times, when the children are unwell, either they overtreat the child or they undertreat the child, or they let that the infection or the issue to take its own course. In the process, the child does develop repeated inflammations of either the tonsils or the adenoids, which slowly enlarge and grow in size, leading to airway obstructions. Once these start, they would find that the child starts opening the mouth and breathes from the mouth, either when sleeping or even while awake. The child also will have an extended neck position and also will be very uncomfortably moving all over the bed whole night. Once the parents find their sleep also disturbed is when they bring the child across to the hospital to get the child assessed, because everyone is losing sleep over this, and they do find that the child is also not very focused in the morning hours or in the school because the child is too drowsy. What these children face is called as obstructive sleep apnea or pediatric obstructive sleep apnea. This requires a detailed evaluation. Most of the times it is a simple obstruction because of a very large adenoid at the back of the nose. So, the adenoid is a tissue which is like any other lymphatic tissue with the tonsils. They act as the first barrier of infections in younger age group below 5 years of age. On repeated inflammations, they enlarge in size. Most of the times when treated well or adequately, the size gets smaller, and then the airway stays open and they are able to breathe. On some occasions, if the gland gets hypertrophied to a point where it is no longer responding to medications, topical medications, and further treatment is not possible medically, it is only when we need to intervene as ENT surgeons, where we have to surgically remove the gland or the adenoid by a process called as adenoidectomy. Do not ignore a child who has snoring. Do not ignore a child who has repeated upper respiratory infections. Please do not ignore a child who has lower respiratory infections as well as asthma. They might also be having an inflamed upper airway soft tissue structures, which include the adenoid. They need to be regularly seen or screened along with the ENTs as well as the pediatricians, so that the child can get the adequate treatment or appropriate treatment at the right time, so that the snoring and sleep apnea issues do not exist for the child, because you need adequate oxygenation. For this reason, we are here as a team at Aster to help you out solve these problems. More than welcome to visit us to get more further information or guidance if any one of you face these kind of problems. Thank you.